Welcome to the Real Bleed experience. Your patent-pending Real Bleed surgical simulation kit. Designed to support 4 stations with 4 specimens, this system allows for high-pressure perfusion of harvested organs and vessels, creating a realistic surgical training environment with active bleeding simulation. The single pump continuously circulates fluid through all 4 stations, returning it to the basin for a self-sustaining rolling system. No need for refills after setup. Kit contents: pump. Tubing with red dot returns fluid. Tubing with blue dot delivers fluid. Basin. Traction needles. Vascular cinches for closing defects. Hemostats. Sutures and ties. Extension cord. Zip ties. Medium and large. Trays. Chuck pads and towels. Scissors. Pickups. Step 1. Prepare the basin. Do not remove tubing taped to basin. Turn basin upside down so the ends come out. Fill the basin halfway with water, and add food coloring, or use real blood if applicable. Step 2. Position components. Place the basin in a central location. Tubing ends to remain in basin are taped permanently. Do not remove. Feed opposing ends out. Position the pump near the basin and connect red dotted tubing ends. Step 3. Set up stations and specimens. Arrange your stations using chuck pads and trays. Lay out specimens securely. Step 4. Connect traction needles to specimens. Identify entry and exit points for the traction needles. Lay the vessel flat on the surface. Insert the traction needle midway along the shaft. Slide a zip tie underneath the vessel. Secure the zip tie hand tight over the needle. Cross-clamp the zip tie with hemostats to create a watertight seal. Step 5. Secure the specimen. Use vascular cinches, suture ties, and zip ties to close all openings. Step 6. Connect the system. Attach tubing with red dot for returning fluid and blue dot for delivery of fluid to the 2 gray traction needles attached to the model. Remember, the blue delivers fluid to the model and the red returns to the basin. Ensure the fluid entry needle is connected to the tubing leading to the pump. Plug in the pump and switch it on. Use the extension cord if needed. If you are not ready to activate all stations or want more pressure to one particular station or stations, use hemostats to clamp tubing lines with blue dots going to unused stations or other stations to redirect fluid pressure. Do not over-clamp lines as it may cause damage. Key components and their uses. Vascular cinches, V-shaped metal tool. Use finger pressure to squeeze the mouth opening over defects in the tissue to provide a quick closure. This is not for teaching good surgical technique. It is a quick way to close models with many defects. Traction needle establishes entry and exit points for fluid circulation. Surgical skills challenge. Enhance your training experience by engaging in a hands-on competitive exercise. Lab partners take turns creating trauma, cuts, or surgical abrasion. Opponents must repair the damage under a timed challenge. Simulates real-world surgical intensity for skill refinement. Additional materials you may want to gather that is not included in the kit. Patches and graft. Micro sutures. Vascular tray and tools. Headlamps and loops. Surgical tape. Additional plastic basins. Eye protection. Gown and face mask. Extra gloves. Bulb syringe. Lighting and timer. Surgical staplers and clips.